We're going to be talking a lot about coping with bladder cancer management in the era of BCG shortages. And it's really interesting. I feel like this topic comes up every few years. We see shortages get worse, get exacerbated, and it's been pretty tough for us as a field to stay resilient. And I think it would make a lot of sense for us to set the stage. I know that although BCG is the standard of care for bladder cancer, I'm not sure everyone knows how we quite got here and why BCG is such a mainstay of bladder cancer treatment. So let's start there. What is BCG and how did we even start using it in bladder cancer?
Great question. BCG kind of originated as a tuberculosis vaccine. And in 1976, there was the first report of using BCG as an intravesical agent for superficial bladder cancer. And that was kind of the early times that started to be talked about. I tell patients it's like a cousin to tuberculosis, so they don't get too freaked out. And in 1990, the FDA approved BCG for the treatment of non-muscle invasive bladder cancer based on years of data that shows that there's a 70% recurrence prevention and also reduced progression, very importantly. So really, it kind of came about like that. And from 1990 until fairly recently, there really wasn't much else out there.
Yeah, great point. I mean, that's exactly what I was going to ask you. It's like for decades, we were relying on something that was really discovered in the 70s. And it's like, okay, fascinating. I mean, we will get to some of the ongoing activity that we're seeing, and there's a lot of excitement in non-muscle invasive bladder cancer now. But, I'm curious, you trained and you started your practice. I guess when you started, we may have been coping with shortages, but at least during training, I know you really did train in the era of reliable BCG supply. And so, at that point, at least early on, how were there any challenges getting BCG to patients? I'm asking because, quite honestly, as far as I can remember, we've been talking about shortages.
Yeah, that's a great question. I really don't remember talking about shortages till late in my residency, which was 2018 was the end of my residency. Until then, I didn't really know that was even a concept. It seemed to me like if we have a drug, we can make the drug and we can give the drug, and why would there be a shortage? But since then, there's been ongoing shortages, including the beginning of when I started practice, which was during COVID. And then also even more recently, I think there's still a pretty good shortage, largely throughout the country, throughout the international community as well, not just here.
Yeah. And so what happened? What happened between the 90s when we really started establishing BCG as a standard of care up until that 2017, 2018 mark?
Yeah, I think a couple things. One, in the U.S., the only producer is Merck after people left in 2012, and Merck can't keep up with the need. Frankly, it takes about 3 months to make BCG or manufacture it. And that, if you imagine, if we're giving that weekly for 6 weeks to thousands of patients, trying to keep up with that is astronomical. And BCG isn't the only thing Merck does. So there are substantial back orders. And now Merck is relying largely on essentially allocation systems, distributing it to high users and distributing less to people who use it less. I know they have a new facility that is planned, supposedly, that will come out in late 2026. I think I will believe that when I see it, but it would be great if that did happen because it definitely an issue.
Yeah, I've been hearing a lot about this facility too. So I, like you, am eagerly awaiting news there. And I can't help it. You know me well, and I'm a little bit of a health policy nerd. And so I think this story is so interesting, right? Because you're right. Merck is the single supplier, but people might ask, why did that happen? And I think it's really because BCG is such a low cost drug. There's not a big margin on it. And so there was less of an incentive for other manufacturers to remain open. And it just exposes some of these real supply chain issues that we've seen obviously in BCG over the years. But, I'm thinking a lot about the gemcitabine cisplatin issue for our bladder cancer patients. Cisplatin had a shortage,
Yeah.
and we rely on for not for this disease state, but for muscle invasive and metastatic, we rely on cisplatin, and that was another carboplatin had a shortage because a plant shut down, and then therefore more people were using cisplatin, and then we couldn't keep up with demand because there was only one supplier. So like common themes here, and I think that it's super, super interesting.